I have to say that was almost more than I knew about myself. Anyway, this talk is dedicated to this paragon of love and mercy over here, and her delightful sidekick, Jackie Boy. Okay, well, let's get right down to brass tacks here. We'll talk about two things tonight: medical care and medical finance in the United States of America in the last century and a half. Now, by way of a historic timeline, I want you to imagine that this is a graph up here. Here's the y-axis. This is going to be medical knowledge and expertise. On the y-axis, we got time. You can pick a time over here: 10 million years ago, 1 million years ago, 10,000 years ago, whatever. The graph of knowledge, medical knowledge and expertise goes like this. We're at 0, 0, 0, 0, 0, 0, 0, 0, 0, until we get to about 1600. Around there, people started realizing that the heart pumps blood through the body. Okay? Gradually creeps up a little bit. In the middle of the 1800s, it starts bending upwards, okay? And then in 1940, 50, 60, it takes off like a rocket ship, all right? Now, anybody in this room that's older than, say, 75 years old, when you were born, there was no such thing as an antibiotic anywhere on earth. Didn't exist, all right? There was no such thing as anesthesia of any kind until about 1840. Vitamins were discovered in the late 19th century. Now they're available in large quantities, purified. Okay, at one time in the 40s and 50s, people were trying to figure out how many iron lungs are we going to need for all these people with polio that we're going to have to put in iron lungs. I have never seen a person in an iron lung, okay? Because in 1955, Dr. Salk, and in 1962, Dr. Sabin came up with polio vaccines, and I have never seen a de novo case of polio in my life, in my professional life or any other time. Okay, in the 1960s, CT scans came in. After that, MRIs, PET scans. All right, before that, we couldn't look at anything in the body except by just plain old x-rays. And those were not available generally until, I think, around the mid-1800s. Okay, now, there might be some people in the room that have had a coronary artery bypass. That very first one was in 1953. It was, of course, nothing like as smooth as it is now, all right? The first kidney transplant was in 1954. We just heard about somebody getting a liver transplant. Liver, kidney, heart, lung transplants are basically routine procedures now. It's not like they're running in like you could get an oil change and goodbye, but people's lives are saved with these procedures, and they can live long, satisfying lives afterward. People live a lot longer with cancer now than they did before, and some people are cured. 59% of people in 2004 versus something like 25% in 1940 are alive 10 years after diagnosis. Some people in this room have probably had endoscopy. These days, you can put a tube down a person, and you can diagnose and treat disorders of the gastrointestinal, pulmonary, otolaryngologic tracts, okay? There are drugs these days that simply did not exist just, 10, 20, 30 years ago. Not to speak of all the antibiotics. Now, we hear a lot of times that infant mortality in the United States is worse than in so many areas of the world. How many people heard that? Infant mortality, oh my God. You know, we're 37th in the world overall with medical care. That's baloney, or even worse. The United States of America counts every infant born at any stage of gestation, no matter what the weight is, if that infant has any sign of pulsation of the cord, any sign of respiration, or any sign of spontaneous muscle movement, as a live birth. A lot of countries do not count an infant as a live birth unless the infant has, been born in a late stage of gestation, weighs a certain amount, has lived for 3 days, and so forth. So infant mortality statistics, if you don't have a live birth, then you can't have a death either. So in those countries, that gets rid of a whole lot of children who, in our country, are counted as live births. So our infant mortality statistics are actually quite good. Now, Americans have won 53 of 65 Nobel Prizes in the years from 1940 to 2004. What are we doing wrong? What are we doing wrong in the United States of America? Okay? 37th in the world? That's baloney. Let's talk a little bit about viral diseases, viral illnesses. If you get a viral illness, it may be mild and you get over it, or it may be severe. In that case, you either get over it, or you die, or sometimes it becomes latent. In other words, the virus is still within you. Recently, starting in around 1978, 1980, 81, we had the HIV epidemic, okay? Young men dying. They get sick, weeks or months later, they're dead. At that point, there was not one single antiviral pharmaceutical on Earth, anywhere, okay? They had never been developed. Now, there are antivirals, acyclovir, valacyclovir, ritonavir, oseltamivir. There's a whole bunch of them, and people with HIV are living longer and longer and longer, okay? And people are being, treated and helped with other viral diseases as well, okay? So, what's it been like for me seeing what's going on in the United States of America? Well, seems to me like medical care has been getting better and better and better over the course of the century. Okay, but when I became a third-year medical student, I would talk to people and I'd say, Mr. So-and-so, have you ever had a heart attack? Oh, my wife might know that. Well, what medicine do you take? It's a white pill. No, I don't know the name of it. Okay. Okay, or somebody's got melanoma, Well, we're both people. Or I've only got one, I've only had one, and I was surprised by this, As far as the infant mortality is concerned, prematurity is the major cause of infant mortality, and it has certain causes. Lack of prenatal care. You can't go out and drag people out of their houses to the hospital, okay, or to the doctor's office. Drugs, smoking, booze, those are big causes of premature birth, which are leading causes of infant mortality. There's a Dilbert cartoon that shows Dilbert. He's a guy in the business, and he's too busy to go to the doctor. So he gets one of his underlings to go to the doctor, and he says to him before he goes off to see the doctor, he says, "And don't let him sweet talk you about diet and exercise. I want pills." Okay, so the CDC did a survey, and they found out that something like a quarter of people had done no physical activity in the last month. 5% had had more than one drink a day. Something like 20% are still smoking. 29% have not seen a dentist in the last year, and so forth. So medical care in this country, we always hear how terrible everything is. It's really very good. What's broken here is the culture. We got a culture of people that they have access to medical care, but they use that to just keep right on boozing and smoking and so on and so forth. In other words, it's, here I am, doc, fix me. I'm not going to do it myself, so fix me. Okay, now, let's talk about where medical financing has been in the 20th century and now into the 21st century. Now, I looked up a couple of codes today for procedures on the neck to fix herniated discs. And I wanted to make sure I had the numbers right because I had a dog who had a herniated disc in her neck. She was paralyzed, okay, could only move her eyes and head. I paid the veterinarian more for the operations on that dog than a human neurosurgeon would be paid by Medicare for operating on you. Okay? Now, all the time I hear about people don't have coverage or they don't have insurance, and I've taken care of people who don't have insurance. A lot of people have a Medicaid card. A Medicaid card is not medical care, however. It's nothing but a card. And if your doctor gets paid less for treating you with your Medicaid card than what it costs him to keep the office running, he's not going to do it. It's just not going to happen. I saw a lot of people on Medicaid in the emergency room. A lot of those people were drinkers and drug addicts, and they were shooting each other and knifing each other, all of which is preventable. If it weren't for smoking, booze, drugs, bad sex decisions, people out naked on the beach, I wouldn't have seen maybe 2/3 or 3/4 of the people I've seen in my medical career. It's true. Okay, now, until 1932, there was a free market in medical care in the United States of America. Okay? If you got sick, you went to a doctor, you paid the doctor did whatever he could for you, same in hospitals. In 1929, it's when it happened, not 1932. In 1929, someone came up with the idea of Blue Cross Blue Shield. And wonderful, except that they went to Congress, they lobbied Congress, and they got special tax treatment for Blue Cross and Blue Shield. And that began the long slide into socialism in this nation with regard to medical care. And when the socialists have a hold of you with your medical care, then you're sunk. And it was the AMA and the American Hospital Association that lobbied Congress, to their shame. All right, so that was just the beginning. So the next thing that happened was that in 1932, the government redefined the terms cost plus and customary and reasonable. And they did that because more and more people were becoming covered with insurance, with real insurance plans. The Elks, the Moose, the Oddfellows, all kinds of trade groups. They voluntarily associated with one another, and they instituted insurance plans for their members. And these were actually insurance plans that indemnified people for catastrophic medical and financial losses because of medical problems. And that was all for third-party payment. Then along comes the war. And we had wage and price controls during the war. The idea being that you can hold the tides back somehow. But employers, they couldn't get anybody to do the work because all the men are sent overseas, millions of men drained from the labor pool overseas. So companies who could not raise their wages attracted the labor force by promising them employer-paid medical care. And of course, it has now devolved into prepaid medical care, not medical insurance. Anybody here who drives a car probably has auto insurance. It doesn't pay for oil changes, tires, gas, batteries, etc. But a lot of people's what's called medical insurance is just prepaid medical plans, and those things pay for every cut and sniffle, some of them, all right, especially if they are obtained through union collective bargaining. And it used to be the case with Medicare, and it still is for the most part with Medicare and Medicaid, that anybody on either of those programs can decide how much of the taxpayer dollar is going to be spent on them simply by calling up, and making an appointment. Okay? So, so now we've got prepaid medical plans and Medicare and Medicaid, and every little thing is run through a gigantic bureaucracy, a gigantic paperwork bureaucracy full of busy work, and everybody that works in it gets paid a salary, benefits, and retirement. Okay, so then in 1948, the National Labor Relations Board, they managed to get collective bargaining for medical expenses, medical insurance. And John F. Kennedy was the one who said that it was okay for government employees to be unionized and to engage in collective bargaining. That's gotten us where we are now, with the country going broke, trying to pay for these people's medical care and their retirements. Okay, and in 1965, Lyndon Johnson comes in with Medicare. Now, was anyone dying on the street at that point? I lived in Washington, D.C. I didn't see anybody out there dying on the street. In fact, there are several books. One of them is Medicare's Midlife Crisis by Sue Blevins. Another one is The Tragedy of American Compassion by Myron Magnet. And the third is, or one of the other ones is From Mutual Aid to the Welfare State. I forget the author, but it's readily available. And this is extensively documented. More and more people in 1965 had access to medical payment plans, and a lot of them were real insurance, where if you had a catastrophic loss, you were indemnified, okay, for that loss. Lyndon Johnson, the stroke of a pen, law of the land, wiped out real insurance for people 65 and older, except for the Medigap plans. In one fell swoop, the guy, we've had a couple of coups d'etats in the country. One of them was FDR. I think we're in the middle of one now. LBJ, he certainly was one. Okay, now, I started paying into Medicare when I was 17, and if I retire when I'm 65, I will have paid in for 48 years. Now, if you were 65 in 1965 when Medicare went in, you got Medicare immediately. And the first Medicare card went to Harry S. Truman. Okay? So without paying him a single penny, he got, years of medical care that was almost free to him. If you were 65 in 1965, you're 113 years old now. For every year less than 113 you've paid into Medicare for 1 year. Just an example, if you're 90 years old now, you paid in for 23 years and you've gotten 25 years of almost free medical care. Now, most people use up the Medicare that they've paid in before they before they die. Okay, if you have a few, like a couple of knee transplants, in a hospitalization or two, that can be used up in a couple of years. Originally, the taxes were much lower, but what with the demographics in the United States, whereas there were initially, I think, something like 25 people paying into the system for every retiree, now we're down to something between 2 and 4 people paying in. Now with Obamacare, the younger people are getting, their people are actually coming out and saying, well, we want you to pay for us, okay? Now they voted the guy in, but they don't vote as much as people that are 65 and older, so naturally they're hanging there for the, for the bills. And I was too when I was a teenager. You may not know this, but every single state has an insurance commissioner, a state insurance commissioner. That person has a lot of power, and people come and lobby that person, and that person says what must be in every standard policy sold in that state. If you're in New Jersey, New York, California, places like that, there's something like 67 mandates. Okay, the insurance policies, of course, have to cover maternity, even if you're a single man, or if you're a guy in his 80s, or a woman in her 70s, got to cover maternity, breast reconstruction, podiatry, acupuncture, the list goes on and on and on. Okay, so naturally, insurance policies with all those mandates are going to cost a whole lot more money. And despite all we hear about the Commerce Clause and so on and so forth, insurance policies cannot be sold across state lines because of these mandates. First thing you're going to hear if you call up an insurance company is, what state are you in? Okay? And that's why that is. Now, if a person could buy an insurance policy, a real insurance policy, in a given state, according to the laws of that state, regardless of where they lived, that would solve a huge problem right there. Because naturally, all the people in New Jersey would go out to Wyoming to buy the policies, or someplace, sensible like that, Texas, for example. Okay. Now, it was estimated that Medicare was going to cost about $12 billion by 1990. Any guesses about how high it is now? It's over $600 billion a year now. Yeah. And in 1973, Congress brought in health maintenance organizations. That basically was to ration care, to keep people from going to the doctor they wanted to go to and to funnel them along in different places. Okay, that combined with, that's been repealed now, but the prospective payment system, that was another gift from the government, which made it so that a hospital got paid according to the diagnosis. It didn't matter how complicated the specific